call the meeting to order, and would you call the roll?
All right, I'm going to give the video just a moment to get started and make sure we're streaming out to the public.
Yeah, that sounds fine.
All right. Delegate Bourne. Delegate Bourne.
Here earlier. Yeah. Okay, go ahead.
Delegate Bourne, you're muted. Delegate Gooditis. Delegate Ware.
Delegate Gooditis is here.
And Delegate Ware.
Pardon me. Senator Saslaw, Senator Serval.
Here.
Senator Spruill.
Here.
Secretary Carey, Commissioner White.
Here.
Vice Chairman Heretic.
Here.
Chairman Barker.
Here.
Mr. Chair, you have a quorum.
All right. Well, as we discussed briefly at the last meeting, and obviously there are a lot of us that are new on the HERC here, so we're just getting familiar with how things operate on a normal schedule. There were no meetings that were held prior to us getting organized just a few weeks ago, and we now have done that. There are a number of bills that have been referred to the Health Insurance Reform Commission that we do need to sort of figure out sort of on each of those which process we want to go through. And there were some that were referred in 2019. Some of those, there's been some action and consideration and some information gathered, but there's more that may be needed on several of those. And then the bills in 2020, we haven't initiated anything on any of those yet. So we'll need to initiate the steps there. Tom, could you sort of run through sort of what the normal processes are in terms of the different types of reviews that can be done on the various things that are referred to the commission?
Yes, sir. For insurance coverage mandates that gets referred to the commission, they go through a two-step process. Step one, the Bureau determines if the bills are within essential health benefits covered by the ACA, and if they're covered by our benchmark plan. That's done by the Bureau of Insurance. Following a step one assessment, the commission can ask for a step two assessment, which the Bureau and JLARC perform, and that they determine the cost of any insurance mandate if we're to pass the General Assembly, as well as the cost. Excuse me 1 second. Lost my notes here. So JLARC looks at the background on the proposed coverage, the medical efficacy and effectiveness of proposed coverage, the availability and utilization of treatment, the current financial impact on individuals without coverage, and the mandate's consistency with the purpose of health insurance and impact on health assessment. The Bureau looks at expected impact on utilization of services and providers, expected impact on premium costs and administrative cost of insurers, expected additional costs to the state as required by the ACA, expected impact on the total cost of healthcare in the Commonwealth generally. So those are step one and step two assessments.
Step one and step two assessments. So are there any questions that anyone has regarding what those steps are and how we operate with those? All right. Well, why don't we go through the list of the bills that we have, starting with those that were referred to the HERC in 2019. Determine sort of what's been done on each of those bills, and then sort of figure out, do we need to, if say, for example, a step one assessment was done, do we need to move to a step two assessment on things? So first bill is House Bill 2710, providing for direct reimbursement by a health plan to law enforcement agencies that provide transportation to someone who's been subject to an emergency custody order or temporary detention order, if the health plan provides coverage for for such transportation. And basically what happens, just so everybody's familiar with the process, when someone is being considered for a temporary detention order, which the first step in that process is emergency custody order, then there's an assessment done. If the person is determined to need to be detained on an inpatient basis in a facility that provides mental health services, there's a process that's gone through by the community services boards and others to determine where to place the individual. And if there's difficulty finding a placement, then the state hospital becomes the provider of last resort in that particular situation. So the individual then is transported to the facility, and I think it's a maximum of 72 hours that they're are held there and provided services, and a determination is made as to whether or not they are should require a hearing to determine whether or not they should be continue to receive care in that facility for a period of time that on average lasts a week or two, to hopefully get that individual to the point where they're no longer a threat to themselves or others in that situation. There's been a long-standing issue in that law enforcement officers, particularly sheriff's deputies, end up driving a lot of these people from the hospital where they're being evaluated in the first place, which is usually in the local community, to a hospital that provides the mental health services. And particularly since the time that we've had the requirements that we put in place in 2014 that have the state mental health hospitals be the provider of last resort if a victim cannot be found elsewhere. Sometimes these people are transported substantial distances. So it does impact law enforcement services within the local community, and that you have one or more individuals, sheriff's deputies in most cases, transporting these individuals substantial distances in some cases. So what this would do would be to provide reimbursement from a health plan for that service to transport the individual to the facility where they would be held for the temporary detention order. It doesn't solve all the problems that the law enforcement agencies have had in these situations, and we are moving to a system where there will be contracted providers who are not law enforcement who will provide these services. But what the bill would do would provide for reimbursement from a health plan to the law enforcement agency, but only in a circumstance where the health plan provides coverage for for such transportation. Was there any step one assessment done on this bill?
Mr. Chairman,
yes.
For any bill that was referred in 2019, the Bureau, where appropriate, did a step one assessment. On this bill, the Bureau noted that as it involves a mandated provider, a determination of whether the bill would create a new mandated benefit that exceeds the essential health benefits was not applicable.
All right. Therefore, we did not do a step one assessment of this.
So the step one would not apply to this bill, sir.
Would a step two process then apply to this bill if we chose to pursue it?
I believe that a step two can look at the cost of health care on the Commonwealth generally, as well as some other factors that don't have to do with the essential health benefits. So the commission could request a step two assessment.
All right. Any questions on this or any?
Yes, Mr. Chairman.
Yes.
My first question is that even with step two, when the sheriff deputy transport, you're talking about transport in a local region or a long distance right now. Let's use Chesapeake for example, which is they can get them from one place to another within 15 minutes. So you're talking about reimbursement for a long distance travel, a reimbursement for local or for all?
I think what this bill would do would be provide a reimbursement for all, so that if it was, say, a transport to a mental health hospital in the Williamsburg area from Chesapeake, it would not be an excessively long transport, but sometimes when the beds are full there or in other places and they've not been able to find a placement locally within the Hampton Roads area, they may be, some of them are transported to other parts of the state, to facilities that are substantial distance and, driving time of, say, a couple hours or more in some instances. So it's not inconsequential on some of these trips. Most of them are handled within the region where the individual lives, where the issue has been evaluated at the local general hospital in emergency department and other things there. But there are some that are long distance.
So this is only providing that the healthcare provider themselves, if they do not have provision for travel, that's when we use the local authorities. Because I'm concerned about the insurance company where they pay for this. Because if they don't use the local authority right now, they have their own means of transportation, get these folks from one place to another. So I want to make sure they don't stop doing that. And let's use the local and cost the taxpayers money.
Well, clearly, what you would have is that the effort is made to find an appropriate placement in the local region. So in your case, from Chesapeake or parts of Norfolk, there would be most of the transports would be in the Hampton Road region, so it would not be a long distance. But there clearly are a number of people, and this has been one of the issues that the sheriff's deputies have consistently raised, that there are a number of people who, when there is not a bed that is found either in a state hospital in the local area or in a community hospital in the local area that has psychiatric services, that these individuals are transported a substantial distance. What this bill would do, as I understand it, is that it would provide for the health plan to pay for it, but only if it has that as a covered benefit in its list of services that it provides. It's not something that they are mandated to provide, and this bill would not say that they would have to provide it if they did not provide payment, if they did not normally do that type of thing.
Thank you.
All right. Are there any other questions? All right. Is there anyone want to make a statement or to make a motion as to whether or not we go to a step 2 assessment on this particular bill?
Mr. Chairman?
Yes.
Just before you all decide on what you would like to go to a step 2, I received an email from Tracy Smith of JLARC this morning, and she mentioned or reminded me that last time at our last meeting, we talked about how a step 2 may take about 12 weeks. Right. Well, she wanted you all to know that it actually may take between a range of 3 to 6 months, and that JLARC capacity for this year is would be able to complete 2 to 3 step 2 reviews. They are engaged in 5 studies that have been directed to be completed in 2021. So as I say, they have the capacity to complete about 2 to 3 step 2 reviews this year. And as you know, one bill, the Appropriation Act in 2020 required that HERC request a step 2 review on that one. So just keep that in mind as you may need to prioritize.
All right. Well, given that information, where there's sort of a limited capability in terms of how many step 2 reviews could go forward in 2021, are there basically, does anyone have any particular suggestions as to how we would handle this particular one? Do we want to do request a step 2, or do we want to not request a step 2? There is coverage that's provided, I think, for transportation from the Medicaid program for those people who are Medicaid eligible. So the transportation is provided for Medicaid. But, my understanding is that most of the commercial plans do not provide coverage for this service now. So even if this bill were passed, since it makes it apply only when they already provide this type of transportation, then there probably would not be a large number of people who would benefit, would receive a payment for the transportation from the law enforcement agency. And as I noted earlier, we are in effect in the process of transitioning to a system where most of the transportation will be done not by law enforcement officers the way it's been done in the past, but through contracts with private entities that do this type of transportation. We did have a pilot program that was run down in the Mount Rogers area, transporting people in these situations when the TDO was issued. And what has happened in most of those situations is it happened in those situations. They were uneventful, and it worked. The system worked very well. So we've now moved to contracting with an entity that provides services in all of Virginia. And eventually, the intent is that eventually we'll get to the point where law enforcement will either not have be providing these transports or will be providing only very few.
Mr. Chairman.
Yes.
Thanks. I guess I would have a motion, although I don't know what the motion is. But I mean, from my perspective, given what you just said, and also given the fact that this cost is already being socialized by taxpayers, albeit by all taxpayers instead of just those who are paying private health insurance, it seems to me this is already being paid collectively in some way, and whereas some of these other things we have to consider are falling solely upon individuals, I guess. And so I would, I don't know if there's a motion to table it or pass. I don't know if it's passed by, or I don't know what the motion is, but it seems to me that this one's not a priority if we only have 3 spots. So I don't know what motion to make, but if you could tell me what motion to make, I'll make the motion.
What do we do usually in these situations?
I don't think you need to make a motion if you're not requesting that JLARC and Bureau perform a step 2. I think you just move on to the next bill.
Okay, I would move that we talk about the next bill.
And Mr. Chairman,
Yes.
this
tell
is
you where.
I wonder, I don't know how many bills we have on the docket, but might we create a list as we go along and, in a sense, put a hierarchy of along the lines that Senator Servell mentioned? Some are higher priorities and others are not so high a priority, and then sort of a pecking order of our thoughts as to which ones go first with our limited review capacity.
Sure, that sounds reasonable. So we can, as we go through them, we can figure out sort of what motions we want to make to sort of get them in the right priority order. But that would certainly be reasonable there. So, we can't do all of these with the step 2 review, but we need to figure out, so that we'll need to figure out which are the highest priority ones to look at.
How many do we have?
We have 1, 2, 3, 4, 5, 6, 6 that are on the list of bills that were referred in 2019. And so these have already gone some type of consideration, and step 2 process would be a possibility in those. And then we have the 2020 ones, which have not had the step 1 process undertaken as of yet. So we could deal with those that were referred in 2020 and deal with those just as a process, for starting the process with the step 1, and would not do a step 2 until after we get the report back on the step 1.
Okay, thank you.
All right. The next one is 2 bills that were introduced in 2019, House Bill 2598 from Delegate Hayes, and Senate Bill 1624 that I had introduced. These deal with services that where a registered surgical assistant may legally perform during surgery services that are provided in a facility. And it provides basically making sure that there are reimbursements that are provided for those services that are provided by the surgical assistant. I think the issue has been that the surgical assistants have not necessarily been receiving compensation from the hospitals or other facilities that are providing the surgeries, and that this would provide a mechanism to ensure that there are direct payments to the surgical assistants when they're not otherwise reimbursed and compensated by the hospital that's there. I did receive an email this morning from the lobbyist for the surgical assistant, Senator Jamerson, who said that we did address the issue of licensure of surgical assistants, which has had some impact. Basically what he says is that as a result of that, they've started to receive some reimbursement, although they're not necessarily happy with the level in terms of the reimbursement in every situation, but that there are issues that need to be considered at some point. They don't think that we should take action to basically request approval of the bills in the General Assembly session, and they say that we should look at sort of continuing to study this during this 2021 year. So, there are issues that have been raised with sort of where the mechanisms for providing reimbursement to the surgical assistants there, and that would have to be something that would be looked at to make sure that there's not payment being provided if there was not a service provided that was there. Any questions or comments on this particular issue?
Mr. Chairman, how are they paid now?
Well, it varies because sometimes some of them are direct assistants, employees of the hospital, and in other instances, it's a situation where the surgical assistant is not an employee of the hospital, but works with the physician or others in the process of providing support for the physicians who are doing the surgeons who are doing the surgery. Part of what has been encountered in the past in some of those situations was that there was no mechanism to provide reimbursement. Now that they are licensed, some of the plans are starting to provide payments directly to the surgical assistants. And there is sometimes a balanced billing issue in that they have to collect, certain aspects of that reimbursement from the patient as well when there's a copay or a deductible that has to be met there. So there are issues that have been raised there. There is progress that has been made, as the reports that I've gotten based upon particularly the licensing that has been done, and which does help in this situation.
I call it double dipping. Somebody's paying them right now just because they got a license. They should have had a license from the start. So I mean, if you work for the hospital and as an assistant, whatever you're doing, somebody's paying them now. So now you're talking about because they got a license, you want to pay them again? No.
No, it's the licensing. What it does is it makes it a little easier for the insurance companies and others to understand sort of what's who actually is a licensed entity provider there, and if they're an employee of the hospital, there's no need. It's in the hospital bill, and so they're compensated from the hospital. So this would not impact those who are employees of the hospital. It's just those who are brought in as surgical assistants but are not an employee of the hospital. So it could be something that we could just continue holding in the committee and in commission here, and look at it during the year, or it's something that we could possibly have as a step 2 review.
Mr. Chairman, just a question.
Yes, go ahead.
Mr. Chairman, are surgical assistants and physician's assistants the same category of practice group, or is this something different? I'm not understanding how a surgical assistant differs from a physician's assistant.
Yes, surgical assistants and physician's assistants are different categories of personnel. The physician assistant is someone who works directly under a physician, usually often in an office setting, and provide services and somewhat akin to some of the types of things that a nurse practitioner does. But one of the differences is that the physician's assistants are directly under an individual physician, and so they are, work directly for and the physician has direct oversight of what they're doing there. The surgical assistants, I mean, these have been brought into the operating room often in situations where there's more complex surgeries being done, and they work under the direction of the surgeon who's there. And the process for having those there and what their responsibility is not always the same, in that sometimes these are employees of the hospital who are there to be able to assist the physicians. Sometimes these are individuals who are independent but who work for some of the physicians and provide support that goes beyond what the hospital has provided with staffing there. So it would seem to me that the two logical options would be whether we wanted to do a step 2 review here, or whether we wanted to just continue to hold it in the commission and see how things develop during the year and see what issues that are out there, and then look at it further at some future date. Anyone want to make a motion or suggestion?
Mr. Chairman, I move that we hold it, look at it for the date.
All right, we have a motion to sort of
I'll
hold it in
second
the
that.
commission for now, and a second. Is there any discussion on that motion? All right, all in favor say aye.
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 All opposed, no. All right, that's what we will do with those two bills that are there. The third one we have from the 2019 list is House Bill 2669 from Delegate Rome, and it would require coverage for medically necessary prosthetic devices and their repair, fitting, replacement, and components. There was a step 1 review that was done, Tom. That was correct. It was step 1 review was done on this one.
Yes,
And
sir.
what did it, and sort of how do you characterize that? So
The Bureau characterized this bill as an extension of an existing essential health rather than as a new benefit for which the Commonwealth would be required to defray the cost.
okay. So would basically say what has to be done in terms of the prosthetics that would be here, rather than providing a benefit for services such as providing a prosthetic device, and which we would be required to pay the cost if that were the case. What are the issues that you see with this bill moving forward? And this bill was also reintroduced in the 2020 session, I believe, in both the House and the Senate.
Yes, it was.
Yes, sir. And both those bills were also referred to her. House Bill 503, Delegate Rome, and Senate Bill 382, Senator McPike.
Okay. What is your understanding, Tom, of what this bill would, what the extension is that what it would provide coverage for that is not covered now in all situations?
Senator, I believe what is the requirement now is that insurance carriers offer to provide this coverage. So it's a mandate to offer, and this make it a mandate to cover. So it would require coverage rather than require that they offer coverage.
Okay. And as it relates to the Commonwealth does provide this coverage. Is that is that correct understanding of what this bill does?
The Commonwealth provides coverage, I'm sorry?
Well, it says an extension of existing essential health benefit. So coverage
Right.
of
So, Mr. Chair, under the ACA, for states that require mandated benefits that exceed the essential health benefits under the ACA, there's a chance that the Commonwealth may have to defer the state would have to defer some of that cost. What the Bureau has said in their step 1 assessment is that because this is an extension of an existing essential health benefit, if the General Assembly were to require this coverage, the Commonwealth would not be required to defray the cost.
Okay. All right. So that we had the option then of doing a step 2 review in this particular case. Is that correct?
Yes, sir.
All right.
Mr. Chairman?
Is this something yes, Senator Serval?
Just to clarify in your prior comments, did you say that JLARC only has room for 3 step 1 assessments, or they only have room for 3 step 1 or step 2 assessments?
Mr. Chairman, Senator Sturgill, the step 1 assessment is conducted just by the Bureau of Insurance. I don't believe those require as much work as a step 2 assessment. The step 2 assessments are done by both the Bureau and JLARC independently.
Scott White, do you want to weigh in here on things, on the sort of help us make sure we understand sort of what we're looking at here in terms of the step 1 and step 2?
Yeah, in terms of the process, Tom's right. We don't have any limitations in terms of capacity to perform these step 1 analysis. The step 2 is much more intensive, and obviously JLARC's already indicated that they have limited ability to perform more than 3. So I wouldn't take into account anything from the Bureau side in terms of our ability or inability to perform these analyses.
All right, thank you. Appreciate that. So I think Senator Serval that the limitation is not on the step 1 reviews, it's on the step 2 reviews, which are more intensive. And I think what we're hearing from JLARC is that they would not be able to do more than 2 or 3 of those in addition to what else they're handling already.
Got it. Thanks.
All right. Do you want to put this on the high on the list that Delegate Ware suggested we sort of start cobbling together, or for a step 2, or do you have any other options that you think we should pursue?
Chairman?
Yes.
Mr. Chairman, I remember when these bills came up in this past session, there was a fair amount of controversy and public support for, offering prosthetic, support. And I would just propose that we put this a little bit up on the priority list. And if we have room for it, that we push it along to a step 2.
All right. Well, we can just sort of
Second.
right now and then come back later with an adopt this specific motion. Senator Spruill, did you start to say something?
No, I second.
Oh, you second that? Okay.
Yes, sir.
All right. Well, we'll just take it in. We'll take a vote then on the motion here. And this would be sort of informally right now set relatively high on the list for a step 2 review. Any further discussion or questions on this? All right. All in favor, say aye.
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 Any opposed, say no. All right. Well, that motion passes. All right. So we have one that now is going to be placed on in an order on the list for step 2 reviews. Next bill we have is Senate Bill 1010, which was introduced by then then do the, so this Senator Black did not run for reelection, but his bill here would require coverage for long-term antibiotic therapy for a patient with Lyme disease. The Bureau of Insurance reported that state mandates coverage for specific drugs to go beyond the number of drugs offered in the benchmark plan does not exceed the employee, the essential health benefits. So the Commonwealth would not necessarily be, would not be required to defray the cost. Is there, anyone have any questions or suggestions of position on this particular bill?
Mr. Chairman, who will, if the Commonwealth is not going to defray the cost, who will pay for it?
I guess the determinations would be made by each of the health plans in terms of what drugs they're providing coverage for that are part of the essential health benefits. And
Okay.
Is that a reasonable interpretation, Tom, as to what be the impact here?
Yeah, yes, sir. I mean, ultimately, coverages are paid for, mandated coverages are paid for by the health plans and then the ratepayers.
Yeah. So that's how it works. So that if there's a service that's covered, then the health plans have discretion in terms of what drugs they think are appropriate for treating that particular issue, that providing that particular service. And so as long as as long as this is not, these drugs would not be on their list for a particular treatment or service that would be provided. And basically this would be things that might go beyond, might be an individual physician might think that some drug would help, but that does not necessarily override the general situation that in terms of how the determinations are made as to what drugs are covered under for treatment for different types of issues there. So right now, I mean, they have, because it is an essential health benefit, they have to cover it when for treatment there if it's determined to be generally medically appropriate. But if it's this is something that a particular physician has an understanding of, or has a belief that this drug would help in this particular situation, but there's not a medical consensus on it, then there would not be a requirement at this time to do that. But what this would do, is, as I understand it, is have the individual physician to be able to make that determination rather than the system operating the way it normally does, where there's a medical consensus, it would be required, but where there's not a medical consensus, then it would not be required. Does anyone want to pursue this issue any further? All right. Well, then, if there's no motion, then we would not put this one on our list for consideration for step 2 assessments and just leave this at this particular time. All right, and then moving on to House Bill 2049 by the outgoing Delegate Carol Foy, who actually has announced resignation, and also Senate Bill 1650 from Senator Howell. And what this would do would require coverage for expenses incurred in the provision of pasteurized donated human breast milk. The Bureau of Insurance characterizes as a new benefit exceeding the essential health benefits. And so if this were adopted, then the Commonwealth could be required to reimburse the federal government for associated costs in provision of this this coverage here.
Mr. Chairman?
Yes.
how does this bill compare with the 2020 bill, House Bill 442, which looks similar, or there's some overlap between the two, it looks like, but I can't quite tell exactly what it is.
The bill is addressing the same issue, and the patron of House Bill 442 in 2020 is the same patron of the House Bill in 2019. Are there, Tom, do you know of any differences between those two bills, or is it basically the same bill? Or is it?
I think they're the same
different-
bill. I'm double checking right now.
Okay.
Mr. Chairman, Senator Serbel, excuse me. The 2019 bill also required that Medicaid cover it as well. And that was not in the 2020 bill.
Got it. Thanks.
All right, so I think we deal with it with what we have here with 2019 and sort of move forward there and figure out sort of whether we want to have this be something that we move on to a step 2 assessment. So do you want to move forward on the step 2 assessment, or put it on the list for a step 2 assessment, and then we'll determine later sort of where it stands on the priority list there? Anyone want to make a motion one way or another on this bill?
Mr. Chairman.
Yes.
Thank you. So I'm just having trouble prioritizing without sort of understanding where we are on all the other bills and which are in step 1 and step 2 at this point. And so it's kind of hard to say. I mean, for me, it's kind of on the bubble, and I'm just trying to figure out, all these others that are on here. It doesn't say on the list we got whether they're a step 1 phase or 2, and so it's
Well, the ones, Senator, the ones that are in 2019 have all had the step 1 process. And so if those were the ones where we'd be considering now moving to a step 2 process. The ones on the 2020 list, presumably with one exception, would be ones that we would do the step 1 process.
right. So Mr. Chairman, does that mean then that we have 2 potential step 2 processes left and 2 bills left on the list that are eligible for step 2?
Well, we have Delegate Rome's bill that we have said that would be placed on somewhere on the rank order of the step 2. We also have the requirement that was in the Appropriations Act that was adopted back in March, which is the last one on the 2020 list, but it does require an assessment to be done there. So because that one is a requirement, I don't think we have too much choice but to put that on basically at the top of the list on the list for step 2.
So Mr. Chairman, then we probably have like 1 spot left for about 9 or 10 bills.
Left. Yes, yeah.
Okay.
So well, let's go down to the next one then, unless anybody wants to make a motion now, and then we can decide whether we would do step 2 for the one for the donated pasteurized human breast milk, or look at the next one, which is House Bill 2601 from Delegate Plum. Well, actually, Tom, is Delegate Plum's not similar to the bill that Senator DeStef had this year, which is what led to the language being included in the Appropriation Act?
Yes, sir. Excuse me. It is similar. It's not identical. I believe the coverage was up to $1,500 in Senator DeStef's bill. Delegate Plum's from 2 years ago was not to exceed $3,000. So a little bit different, but yes, the same mandating coverage for hearing aids for minors. So I think with the required step 2 assessment of SB 423, you may get most of that for HB 2601.
All right. Well, then actually we would be able to maybe sort of combine, can we combine sort of the what's in the Appropriation Act and then add to that the option of have it going up to the $3,000 per hearing aid. So if they look at it as both a $1,500 cap and a $3,000 cap. I assume that would be a reasonable approach here. So we're not trying to do two separate reviews of the same issue.
Mr. Chairman, do we need a motion to combine them?
We could, yeah, I think we should consider that. We clearly are required to do the coverage thing that's in the Appropriation Act, which was related to Senator Steff's bill. But then what we can do is ask them to also, while they're doing that, look at the difference between a $1,500 per hearing aid cap and a $3,000 hearing aid cap, which would deal with. So
do we need a motion to we need a motion to combine those two together?
That would be fine. Yes, you want to make that motion?
I also move, Mr. Chairman.
And I'll second that.
All right. Motion to combine those two. All in favor of combining those two, say aye.
Aye.
George, you're kind of breaking up, but we can't hear you.
Okay, I'll speak up and see if that'll help. So, all right. Well, we have then two issues that we put on the plate for step 2 reviews. One is the hearing aid one, which we're required to do based upon the language in the Appropriations Act. And the other is Delegate Rome's bill from 2019, House Bill 2669 for the prosthetic devices. And then if we had those as our top two, then we would make a decision as to whether to add a third one, which would be the one that was Delegate Carol Foy's and Senator Howell's bills in 2019, and that provided coverage for expenses incurred in the provision of the pasteurized donated human breast milk. Does anyone want to make a motion relative to doing a step 2 review for the expenses for the provision of pasteurized donated human breast milk coverage?
Mr. Chairman, I'll make that motion. I know it might not be a big issue to many, but here locally we have CHKD, the Children's Hospital of the King's Daughters. I know that's an issue to them locally, and I think it's worth at least looking at to see what the price tags are and see if we can actually afford that coverage. So I would move that.
All right, we have a motion. Is there a second?
Yeah, he forced me to suck that, Mr. Chairman.
All right.
Thank you, Senator.
That's right. So is that your second, Senator Spruill?
Yes, sir.
All right. All right, we have a motion and a second to put this as the number 3 issue on our list that we would go forward with requesting step 2 reviews for these 3 would be our third issue. Is there any further discussion on that issue? All right. All in favor, say aye.
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 All right. Any opposed, no. All right. Then we have our list of things that would be the step 2 reviews. And that would be the hearing aids, the prosthetics, number 2, and the donated pasteurized human breast milk as number 3. So we have dealt with our step 2 review issues there. Then maybe we go a little quickly through these others. I assume that since these are on our list here and they have been referred, these would be ones that would be candidates for step 1 reviews. Is that correct, Tom?
Yes, sir. And I just want to point out 3 of them fell off the list. For that, there's also SB 192 from Senator Peake, which was about cost sharing requirements for physical therapist office visits. SB 1086, which would mandate coverage for infertility treatment. And then Senator Peterson, SB 867, had a bill about provider panels and vertically integrated carriers.
Okay.
To your previous question, yes, I think you could in a block request that the Bureau conduct a step one assessment where applicable on all the 2020 referred bills.
Okay, and is the SB 1086, is that similar to or identical to the House Bill 776 by Helmer, Delegate Helmer?
They both deal with coverage for fertility. Delegate Helmer's bill is about fertility preservation for those with cancer, whereas Senator Pillion's bill is more broad for infertility treatment.
More broad. Oh, okay, it's a broader bill. Okay. All right. And Senator Peterson's bill is a different issue there than sort of the mandated benefits. It's I mean, it was referred to the HERC, I remember, in the committee when it was heard as an issue, but I think that would probably not be something where we would necessarily have a step one review, but try to figure out as we get to the point past whatever our sessions are going to be in 21 to moving forward to figure out sort of how we can deal with that issue as well. So I think that would be a separate thing, a separate issue rather than something that would go to a step one review. With that, is there a motion to have all the bills other than the 2020 bills, other than things that are basically duplicates of something that was that introduced in 2019 and Senator Peterson's bill go to a step one review?
So moved.
All right,
Second.
there's a motion
Second.
to do those across the board and a second on that. And so we then have all of those bills would be referred for that. And actually, yeah, and actually Senator Steph, we're doing the step two review on that one, that Senate Bill 423. Isn't that his hearing aid bill? So,
Yes.
So we don't need to necessarily do a step one review on that one since we're doing the step two and it's already been enacted, as I recall. Is
Yes,
that correct?
That's correct.
All right.
That's
All
correct.
right. All right. So we have the others that are not, that are not duplicates of something that was dealt with for the 2019 bills. We have Senator Steff's that we're pulling out there, and Senator Peterson's, which we will handle separately from the process for the mandated benefits. So is there any further discussion or questions on that?
Hey, Senator, if you have a moment, I would like to go back to one of the 2019 bills, the House Bill 2669 related to prosthetic devices. And I believe that the recommendation was made to move this forward to a step two analysis. Is that right?
Yes, that's correct.
So I've been texting with one of my staff, and we've noticed that the information we have on the summary that Tom relied on has changed as a result of new federal 2021 federal rules. Basically, the new rule says that if there is a mandate that was enacted after 2012, then it is a new mandate. And it can't be an existing mandate. So there would have to be state defrayal. So that does apply to this prosthetic devices. We indicated in our notes that it's a mandated offer of coverage, but it's part of the EHB. It was an existing service to an EHB, so we didn't think there would be a defrayal. Based on what the new federal rules tell us, though, because this is not a mandate prior to 2012. There would need to be a state defrayal of costs. So I just want to make sure that was part of your analysis. If the committee is opposed to any state deferral for this particular coverage, and that should impact potentially how you move forward to whether you want to do a step 2 analysis.
Anybody have any comments or questions as it relates to that information? All right. I assume that in general, then, if we don't make a motion to pull it out, that we would go forward with the step 2, and would be with the understanding that this does have the potential for some cost to the Commonwealth. And because we're having the step 2 referral assessment done, we would be able to evaluate that information and have that factor into our decision as to whether to move forward in 2022 for a recommendation on this issue, as a result of that information. So, all right, well then we will go forward with the step 2 review on the prosthetics one, with the recognition that part of what will be looked at too would be what the impact would be to the Commonwealth for coverage here, as well as the other issues that would be addressed there. All right, then I guess, did we vote on the motion to have all the 3 issues dealt with in the step 2 review list there? I forget whether we voted on the motion. Did we vote on the motion?
Senator, can I interrupt again, if
Sure.
I may?
Yes.
I just got another text from my staff, and Tom, I may need your assistance on that. They're indicating that with respect to the hearing aids, that there has already been a step 2 analysis done by both the Bureau and JLARC, which I wasn't aware of, but that's what my staff's telling me, that we did it of our own volition as a result of the budget study.
Okay. All right. Well, as long as that's already been done, then we would get those that information and look at that in terms of how we move forward on things. Is that something
Chairman,
that? Yes.
Just a question for Commissioner White. The budget required JLARC and the Bureau to look at the potential for changing the benchmark plan.
Right. Our understanding is that the study that occurred was essentially the equivalent of a step 2 analysis, though.
Okay, thank you.
We may need to go back and look at that, but that is what I'm being told at the moment. I just want to make sure. I just wanted to bring that to your attention.
I appreciate that. So
Yeah,
I think it helps us a good bit.
You could perhaps move it forward and then elect not to proceed if we determine that a step 2 analysis has effectively already been done, perhaps.
Right. All right. Well, probably would also be helpful for us to have those analyses that have been done by both JLARC and the Bureau prior to the legislative session. So, working with Tom, you can get copies of those sent to us, then that will help us in terms of any action we might want to consider making in the legislative session in 21. And we can determine whether or not we need to have a separate meeting or just let it be dealt with through the process in terms of the whatever action might be taken and follow up on the budget language.
Absolutely.
All right, that sounds good. So then what we have is that in addition to that analysis, which has already been done, then we would have 2 others that we would have, which would be the prosthetics and the donated human breast milk. All right. I think that motion, I think we voted on the motion. Is that correct?
Yes.
Yes. Okay. All right. As long as we voted on the motion, we're good. So we've done that. And then we will also then at our first meeting, probably after the legislative session in 21, figure out sort of how we're going to deal with the issue in terms of Senator Peterson's bill there. So is there anything else other than public comment that we need to address today? All right. Then why don't we go to public comment?
All right. There are 4 people signed up for public comment. Awaiting the first one, it looks like, who is signed up is Morgan Guthridge with Guthridge Associates. I'm moving him in now.
Okay. Mr. Guthridge, you're on. We can get you in and unmuted. On my screen, you're listed as muted.
They may have stepped away. So we'll move on, Mr. Chair, if it's all right with you, to Mr. James Rossitelli with Virginia Senate Finance and Appropriations.
Okay. Yes, Mr. Rossitelli.
Senator Barker, yeah, there must be a mistake. I don't have any questions. I'm just observing and taking notes.
Okay. Well, we hope you have good notes. We may need them, so.
Okay. Very well. Thank you.
All right. Thank you very much. All right. Who's next on the list? So.
Finally, Ms. Tina Jaha.
Who is that?
Ms. Tina, pardon me.
Sorry, I actually don't have any questions. I was just listening and taking notes on the commission.
Okay.
Okay.
Thank you.
All right. Well, we're moving fast through these, so.
That is it, Mr. Chair, for public comment.
All right. Okay, that's what we have in terms of public comment then. All right, and I assume, I'm not hearing it, is Morgan Guthridge available? Since we did not get a response from him.
Hello, Senator Barker.
Yes.
This is Morgan Guthridge. Like the others, I was just observing the meeting. I have no comments.
All right. Okay. Thank you.
Thank you, sir.
Apparently, we did such good work. Everybody dropped their comments, but.
Mr. Chair, pardon me. One more. We have Mr. Ben Dendy with Vector Corporation.
Okay. Ben, you're muted, so unmute here.
Likewise, I think what happened, the thing today to get in, you had to sign up. And so I guess that was the confusion.
Okay. All right. All right. Well, we thank you, and we'll see you around here at some point. So, all right. That takes care of public comments in short order, to say the least. Is there anything else anybody wants to discuss today? So, all right. With that, we will distribute the assessments that have been done related to the hearing aid issue, determine whether or not we need to have a meeting. When,
pardon me, Mr. Chair. One more
certainly.
finally has arrived, Mr. Doug Gray.
Okay.
Hi, everybody. This is Doug Gray on behalf of the Virginia Association of Health Plans. I just wanted to thank you all for your work on these issues and your deliberations. I realize it's difficult to do things in this environment. One challenge that I have is, usually when we talk about an issue, we can have comment on the issue by issue basis. And one of the challenges with things being remote and commenting afterwards is already over. So and so I just thought I would share that observation with you. It's fairly challenging. I don't have any disputes or concerns with what you guys have decided thus far. I would just remind you there is an interesting tension between having to pay a cost when you add a benefit, and then this idea of at some point in the process being able to change your EHB to something new that might include a broader coverage. And nobody's really gotten their hands around whether that's a good idea or how to do it or when to do it or what would be appropriate. And so it's just an issue that's out there. It's obviously going to be brought up when people talk about the reports on the hearing aid issue as well. So I just want to thank you all for your work, and hope we can actually talk face to face someday. Thanks.
Yes. Come back in the spring. So, we may by spring or early summer be able to do that. So, all right. Well, thank you, Mr. Gray, and I appreciate your comments there. Is there anything else from members of the commission? All right. Is there? We'll distribute the information on the hearing aid issue and determine whether or not we need to have a meeting leading into the session, and then figure out and then deal with the rest of it, everything else after the session. Then. All right. Is there a motion to adjourn?
So move.
Is there a second?
Second.
All right. All right. I figure we're all having so much fun. Everybody wanted to stay around. So,
Oh, ho,
all
ho.
right. Motion to adjourn. All in favor, say aye.
Aye.
All opposed, no.
No.
We are adjourned.
Sproul can stay on.
We are adjourned, and happy holidays to everybody. So stay
See you,
safe.
Mr. Chairman.
Thank you, Mr.